Good morning, everyone. Okay, let's do that again. Good morning, everyone. Good morning. It is nice and sunny, and we are under this amazing material that somehow allows us to be cool in the middle of this. It is a really good day. Allow me to stand on the already established protocols and allow me to indicate how truly happy I am to stand here in partnership with my colleagues to ensure that we truly care about the communities that are vulnerable. So it's not just about vulnerable communities, though. It's about this Tobago House of Assembly recognizing that we are tasked with developing whole human beings. Whole human beings are human beings who are economically thriving, who are nutritionally sustained, who are medically well. And this community care project is one that, when I saw the introduction to it and when I saw what we were doing coming out of the Division with Responsibility for Food Security, I had no choice but to say the Division of Health, Wellness and Social Protection would certainly be a partner with this project. Because to be honest, what you are doing, Secretary and Assistant Secretary, makes my life at the Division of Health, Wellness and Social Protection significantly easier. How does it make it easier? I had a conversation yesterday with individuals who are part of the primary care system in the Tobago Regional Health Authority, because we are starting to work on restructuring how we provide health care on the island. And one of the things we discussed yesterday afternoon was the fact that our highest burden at the Tobago Regional Health Authority has to do with diseases that we can control based on our lifestyle. A big chunk of our lifestyle has to do with what we eat. Yeah? I had to say to them yesterday that every single month I have to approve from the Division of Health, Wellness and Social Protection sending at least, and the CEO said only when I said the number, at least $41 million every single month to the Tobago Regional Health Authority. Because that is what it costs every single month, and the CEO nudged and said, well, what we're really asking for is 45. But when we have to manage the resources, we send about 41, 42 to get the health system working. And part of the discussion yesterday was the fact that the more expensive kind of health that we provide is at the secondary care. But if we are able to do the prevention that's needed in the communities, if we are able to do the then primary and secondary prevention that is needed in the health centers, we will then prevent people from going to the hospital where it is extremely expensive. Now, the other part of what I do is the social protection part, which includes ensuring that individuals, communities, families are able to withstand shocks. That is the definition of social protection. And in this case, in many of the cases that we see, the shocks that communities and families and individuals experience are shocks relating to inability to feed themselves and their families. So again, we are very, very welcoming of this project because it means we now have another opportunity to tap into another resource that allows our communities to get the kind of nutritional support that is healthy. Now, the third part of this has to do with the economic development, because this now provides an opportunity for our farmers, our food processors, to have a space for their product. Another reason to not come to my division because you're looking for a work or you're looking for some other kind of social support. So I want to take this opportunity to say to the crafters of a project like this, thank you so much for conceptualizing it. Thank you so much for reaching out to all of the partners. And thank you so much for implementing so that we can get to the point where we have an official launch. Give yourselves a round of applause. And I would end in a way that I have been trying to end almost all of my public speeches by saying, the Tobago House of Assembly has been tasked with a Herculean task. It is huge when you think about it from the macro level. It is huge when you think about it from up there, which is to make Tobago the greatest little island on the planet. But if we think about it from an individual level, this project is helping to make Tobago the greatest little island on the planet. The agricultural workers, the farmers, the nurses, the nutritionists, everybody who is sitting here doing their part is helping us to recognize that goal. And because of it, I want to thank all of you for actively participating in this process, because when you do what you have to do, when we do what we have to do, we really can arrive at this space where Tobago truly is the greatest little island on the planet. I thank you.